Hey everyone, welcome back to Baridi Health, your go-to for science-backed insights into natural health. We're talking about those two bean-shaped organs working hard to filter your blood and remove waste products. Catching these signs early can be a real game changer for your health, so let's get started. Alright, let's kick things off with a symptom that can often be mistaken for just being busy or stressed out. Persistent fatigue and weakness. We've all had those days where we feel drained, but if you're constantly feeling exhausted, even after a good night's sleep, it's worth paying attention to. You see, when your kidneys aren't functioning optimally, they can't effectively filter out waste products from your blood. As these toxins build up, it can lead to a condition called anemia, where your body doesn't produce enough red blood cells. Red blood cells are like those little delivery trucks that carry oxygen throughout your body. Without enough of them, your muscles and organs don't get the oxygen they need, leaving you feeling wiped out even after minimal exertion. So if you're constantly reaching for that extra cup of coffee or feeling like you can barely make it through the day, it might be time to check in with your doctor. Moving on to our next sign, let's talk about swelling, also known as edema. Now, it's normal to experience some mild swelling in your feet and ankles after standing for long periods, especially in hot weather. But if you're noticing persistent puffiness in your feet, ankles, or even your hands, it could be a sign that your kidneys aren't doing their job properly. One of the key functions of healthy kidneys is to remove excess fluid and waste from your body. When your kidneys aren't working efficiently, this fluid can build up in your tissues, leading to swelling. Think of it like a plumbing system. If the pipes are clogged, the water backs up. Similarly, when your kidneys can't keep up with fluid removal, you might see it accumulating in your extremities. So if you're noticing your rings are feeling tight, your shoes are fitting snugger than usual, or you're seeing puffiness in your face, particularly around the eyes, it's essential to get it checked out. Now, let's talk about something we all do, but maybe don't discuss enough: urination. Changes in your bathroom habits, both in terms of frequency and the appearance of your urine, can be important indicators of kidney health. Think about it. Your kidneys are like your body's filtration system, constantly cleaning your blood and producing urine as a byproduct. So, any significant changes in this process can be a red flag. You might find yourself needing to pee more often, especially at night, or you might experience a decrease in urine output. Keep an eye out for any changes in the appearance of your urine as well. Does it appear foamy or bubbly? This could be a sign of proteinuria, where protein is leaking into your urine, indicating kidney damage. Also, take note of the color. Is it unusually dark or discolored? These changes could signal that your kidneys aren't filtering your blood effectively. Remember, our bodies often communicate with us through subtle signs. Don't ignore what's going on in the bathroom. It could be your kidneys trying to tell you something. Let's be real. Nobody likes feeling nauseous, or even worse, experiencing vomiting. While these symptoms can be caused by a whole host of things, from a stomach bug to food poisoning, if they persist or are accompanied by other symptoms on this list, it's worth considering your kidney health. Why? Because as your kidneys struggle to filter waste products effectively, these toxins can start to build up in your bloodstream, leading to a condition called uremia. Uremia can wreak havoc on various systems in your body, including your digestive system. The buildup of toxins can irritate your stomach lining, leading to feelings of nausea and that icky urge to throw up. You might also notice a metallic taste in your mouth, which is another telltale sign of uremia. So, if you're experiencing persistent nausea or vomiting, especially if it's accompanied by other symptoms like fatigue, changes in urination or swelling, don't just reach for the antacids. Reach out to your doctor. Let's talk about something that can be a bit tricky: changes in appetite and weight. While many people struggle with wanting to lose weight, unintended weight loss, especially when accompanied by a loss of appetite, can be a concerning sign, particularly when it comes to kidney health. Remember those pesky toxins we talked about earlier that build up when your kidneys aren't functioning properly? Well, they can really mess with your appetite. Uremic toxins, those waste products that your kidneys usually filter out, can accumulate in your body and lead to a condition called uremic anorexia. Essentially, these toxins can suppress your appetite, making food seem unappealing and leading to unintentional weight loss. So, if you're noticing that your clothes are fitting looser, you're not as hungry as usual, or you're even losing weight without making any conscious changes to your diet or exercise routine, it's crucial to bring it up with your doctor. Now let's address an uncomfortable and often overlooked symptom: dry, itchy skin, also known as pruritus. We all experience dry skin from time to time, especially during the colder months. But if you're experiencing persistent and intense itching that just won't quit, it could be a sign that your kidneys are struggling. Remember, our kidneys play a vital role in maintaining the balance of minerals and nutrients in our bodies. When our kidneys aren't functioning optimally, waste products and toxins can build up in our bloodstream. This buildup can disrupt the delicate balance of our skin's natural oils and moisture, leading to dryness and irritation. Furthermore, as those toxins accumulate under the skin, they can trigger an inflammatory response, leading to relentless itching. So, if you're constantly scratching, lotions and moisturizers aren't providing relief, and you're noticing other symptoms on this list, it's time to schedule a visit with your healthcare provider. Let's talk about those annoying and sometimes painful muscle cramps and twitches. We've all experienced them, often after a strenuous workout or due to dehydration, but if you're noticing frequent and unexplained muscle cramps, especially in your legs or feet, it could be a sign of underlying kidney issues. You see, our kidneys play a crucial role in maintaining the delicate balance of electrolytes in our bodies, including minerals like calcium, phosphorus, and potassium. These electrolytes are essential for proper muscle function, and when their levels are thrown off balance, it can lead to muscle cramps and spasms. When your kidneys aren't functioning properly, they may struggle to maintain the right balance of these electrolytes. Specifically, you might experience low calcium levels, known as hypocalcemia, and high phosphorus levels, or hyperphosphatemia, both of which can trigger those uncomfortable muscle contractions. So, if you're constantly dealing with muscle cramps, especially if they're accompanied by other symptoms like fatigue, changes in urination, or swelling, it's essential to get checked out by your doctor. Now let's talk about a symptom that can be quite alarming: shortness of breath, also known as dyspnea. We all experience shortness of breath after intense physical activity, but if you're finding it difficult to catch your breath, even after minimal exertion or at rest, it's crucial to pay attention, as it could be a sign of kidney distress. There are a couple of ways kidney problems can lead to shortness of breath. Firstly, when your kidneys aren't functioning properly, fluid can build up in your body, including in the lungs. This condition, known as pulmonary edema, can make it feel like you're literally drowning, making it difficult to breathe. Secondly, remember how we talked about kidney problems potentially leading to anemia? Well, anemia, a decrease in red blood cells, reduces your blood's capacity to carry oxygen. This means your body, including your muscles and organs, doesn't get enough oxygen, leaving you feeling breathless. So, if you're experiencing shortness of breath, especially if it's accompanied by other symptoms like fatigue, swelling, or chest pain, seek medical attention immediately. Let's talk about a silent killer that often goes unnoticed: high blood pressure, also known as hypertension. High blood pressure is often called a silent killer because it doesn't always have obvious symptoms, but it can quietly damage your blood vessels and organs, including your kidneys. Now here's the catch-22. Kidney problems can both cause and be caused by high blood pressure. You see, your kidneys play a vital role in regulating blood pressure. They do this by filtering waste products and excess fluid from your blood and producing hormones that help control blood vessel constriction and dilation. When your kidneys are damaged, they can't regulate blood pressure effectively, leading to hypertension. On the flip side, uncontrolled high blood pressure can further damage your kidneys, creating a vicious cycle. The high pressure puts extra strain on your kidneys' delicate filtering units, making them work harder and potentially leading to further damage. So if you have high blood pressure, it's crucial to manage it effectively through lifestyle changes and medication as prescribed by your doctor. Regularly monitoring your blood pressure and taking steps to keep it within a healthy range can go a long way in protecting your kidneys. Finally, let's address a symptom that can impact our daily lives significantly: cognitive issues and difficulty concentrating. We all have those days where our brains feel a bit foggy, but if you're experiencing persistent brain fog, difficulty concentrating, or even memory problems, it's essential to consider all potential causes, including kidney health. Remember those pesky toxins we've been talking about that build up in your bloodstream when your kidneys aren't functioning properly? Well, they can cross the blood-brain barrier and wreak havoc on your brain function. This buildup of toxins can interfere with your brain's ability to process information, leading to cognitive impairment, difficulty concentrating, and even memory problems. You might find it challenging to focus on tasks, feel mentally sluggish, or have trouble remembering things. So, if you're experiencing persistent brain fog or cognitive changes, especially if they're accompanied by other symptoms on this list, it's crucial to consult with your healthcare provider to rule out any underlying kidney issues. If you're experiencing one or more of these signs, talk to your healthcare provider about testing your kidney function. Simple blood and urine tests can catch issues early. And of course, I'm not a doctor. This is educational content. If you found this video helpful, please give it a thumbs up, subscribe, and hit the bell so you don't miss our weekly health deep dives. Drop your questions in the comments below and check the description for links to reliable resources. Thanks for watching Baridi Health. See you next time.